And we're live.
Hello, and welcome to the Group Medicare webinar. I'll give everyone a moment to make sure that they are in the right place before we begin. But this is being presented by Group Benefit Partners on behalf of the Iowa State Association of Counties, so welcome. Next slide.
Oh, sorry.
That's okay. Okay, so we'll start by introducing who is here to present today. So from Group Benefit Partners, there are three of us who you can probably see if you have that capability. We'll turn off our cameras here momentarily so that you can focus on the presentation. But to introduce ourselves, my name is Katie Schmidt. I'm a Client Services Manager with Group Benefit Partners. Elizabeth Opie is here as well. If you work with the Isac Association of Counties and the Group Benefits Program, you're probably used to working with us. In addition, we have Tyler Christensen, who is one of our benefits consultants. There may be some other members of the Group Benefit Partners team on the call today. We have locations across the state, so welcome to any of our colleagues who are here as well. And then we're happy to have two representatives from the Wellmark Medicare team on the line with us. Additionally, Corey Hooger and Lindsay Trueblood. And so they will be participating as well and probably helping us with questions as those come up. This is new for us in terms of offering a group Medicare program. And this is what their specialty is. And so we're really happy to have them alongside us to help point us all in the right direction as we navigate through this. And then I wanted to just briefly talk about Group Benefit Partners. Again, if you're part of the Isac Group Benefits Program at all with the medical, dental, or vision, it's likely that you're aware of who we are and work with us. But if not, since this is being offered to all 99 Iowa counties, it's likely that there are some participants on the call who maybe haven't heard of us or aren't familiar with Group Benefit Partners. So you can read the screen, but just to point out a little bit about who we are and why we're here. We have office locations across the state of Iowa. Elizabeth, Tyler, and I are in the Clive, Iowa location. Our office is the Isac Group Benefits Program Consultant. And so that's really why we're here today, is to offer this on behalf of Isac as part of the variety of different programs that are offered to member counties. As an agency, Group Benefit Partners works with over 600 employer clients across the state. And we're proud to say that out of those employer clients, over 35 of those are county clients. And so we do feel very comfortable when it comes to working with counties and county business and the ways that counties run their employee benefits program. So you can see our map. It kind of gives a footprint of where Group Benefit Partners is representatively across the state. So that's just a little bit about who we are. And I'm sure you're all very familiar with Wellmark and who they are. So with that, we'll kind of get started. A quick agenda today. My intention in terms of providing information is to keep this at about 30 minutes or less. I know we're scheduled for an hour. We do want to take questions. If they come up as we are presenting, we are more than happy to stop and answer questions that are pertinent to that portion of the presentation. Although we will also take time for questions at the end. One caveat to that is that when we start talking about Medicare, it can get individualized very quickly. And there are many complexities and individual situations when we're dealing with Medicare. And so we ask for your understanding in advance if a question arises that we say, we're going to table that question and ask that you reach out to us individually. Our goal here today is to provide some basic overview of Medicare, to really introduce the new program, the Isac Group Medicare, what you would need to do if you're interested in that, and then really to help be a resource for any Isac employees, soon to be retirees, or current retirees who want some help navigating the world of Medicare. You know, one of the things that we hear most often in the insurance world, we hear it from friends, we hear it from family, we hear it from our clients, both at the employee and the employer level, is this is complicated. As we approach that retirement age and start becoming inundated with information about Medicare, I've heard so many times, I wish I had one person, or I wish I had one resource that I trusted that I could go to kind of sift through all of these other pieces that are coming at me. And so we've worked with Isac for quite a while now to try to be that resource for county retirees who are entering that Medicare eligibility age. So a quick overview of Medicare. And Medicare, as I've said, is very complicated. We certainly can be a resource for you to help you understand this whole process in more depth. But for the purpose here today, it's going to be very high level. So this slide just gives a quick description of what it takes to be Medicare eligible. And so the two parts, original Medicare, sometimes they're called Part A, Part B. You can see there the descriptors of what is required to be eligible for those parts of Medicare: 65 or older, disabled, or suffering from end-stage renal disease. There are many specific rules that go along with that. So you may ask, well, what does it mean to be disabled? Or the most common question that we get is, what is the timeline? When do I need to begin this process? That is information, again, that we can help you work through. I've also put a link on here to a pretty handy document from CMS that when we send this out as a recorded version and as a PDF, everything that you see underlined is linked to a particular place in the internet that's a helpful resource that, as you work to gather some information, is a place that we think contains some information that could be useful to you. So getting into the complexities of that is more than we want to do today, but it's certainly something that we would be happy to help you with, and at the very minimum, be able to provide you resources to do that research for yourself. So there are then some required, and you can see I have an asterisk there, and I'll explain why. There are some required Medicare parts. There are Part A and Part B, and those are really separate from what we are able to do as consultants. Again, we can help consult you on the rules, the timelines, but those are not products that are sold by us. And so Medicare Part A and Part B, typically some people are automatically signed up for Part B. Some people have to sign up. Those rules can vary based on your circumstances, and we could help you think you understand that better. But those are separate. So those need to be gained on your own. And then Part D is kind of a hybrid. So while Part D is not technically required, we like to consider it as a requirement because our feeling, Part D is the prescription drug plan. And so if you do not enroll in Part D when you are initially eligible, if at some point during your Medicare eligibility, you require prescription drugs, which is very likely, if you did not sign up at the beginning, you can face some pretty hefty late enrollment penalties. So that is not a situation that we want to see anyone having to endure. So we do consider this a required Medicare part. Part D, prescription drug plans, is probably, and if anyone agrees or disagrees, probably one of the areas that we get the most questions about. And so this is a place where you can really start taking action as soon as possible. So even pre-65, you can start to plan in advance for your Medicare enrollment, particularly with that Part D. And what we recommend you do is begin by reviewing your prescription drug information. What prescriptions are you on? What are you paying for those prescriptions? And then if you're the kind of person who likes to do some research on your own, I've linked there to the Medicare.gov prescription drug plan page. There are numerous companies who sell prescription drug plans. It can be overwhelming. We in our office here in Clive, we sell the Wellmark prescription drug plans. But again, those are by no means the only plans that are offered. But we're working here in collaboration with Wellmark. Isac has partnered with Wellmark for a very long time. So that is also linked to what Wellmark offers for the prescription drug plan. But again, reach out. Group benefit partners, we are certainly able to help you make some decisions based on your particular situation. But again, that gets very individualized in terms of what prescriptions you're taking, what premiums you're comfortable paying. And so don't get overwhelmed. It can be very overwhelming, and understand that one of our main purposes here today is to let you know that we can help guide you through that transition. So as you leave your employer-based medical coverage or your retiree plan that you may be eligible to stay on pre-65, and you start preparing for Medicare, as opposed to trying to figure out who you should work with from all of these people who are reaching out, if you want to consider us as a resource, we're happy to be that for you. And then we'll talk next about recommended Medicare plans. So while Parts A and Parts B cover a lot of your Medicare expenses, or a lot of your medical expenses, they will not cover all. And so we do highly recommend that you consider an additional Medicare plan to supplement A and B. And there are really two options now that you have with that. Prior to July 1st, what we would have recommended is that you look at the individual supplements that are available. Once again, we have Wellmark's list there that you can go out and see what Wellmark offers and what Wellmark sells. Again, Wellmark is not the only company selling supplement plans. There are a variety of companies. There are pros and cons and differences in cost and coverage that are really very extensive. So Medicare.gov, again, is an excellent resource. You can log in and create an account on Medicare.gov prior to reaching age 65. So you really can begin this research process, if you're interested in doing that on your own, at any point, so that you can feel comfortable and confident and aware of some of the different options that you have. What is new starting in July is the Isac Group Medicare program. And so we're going to talk very specifically, or as specifically as we can at this point, pretty much for the rest of the presentation. But what I have in bold there is that Group Benefit Partners, our company, can educate and sell both individual supplement plans as well as the Isac Group Medicare plan. And our intent would always be to work with you as an individual to make the best determination for you. And so, we are not incentivized either way to point you in one direction or the other. The group Medicare plan is something that we feel there are some strong benefits to that we'll point out here momentarily. But we definitely would be able to work with you on a one-on-one basis to talk about different options, different costs, different coverage levels, and to get you signed up for what would be best in your individual situation. So we talk about Medicare as extremely complicated, and there are so many options out there, and it can be confusing. So you might be asking, why throw another option into the mix? And I guess that really leads us to the why. And one of our biggest whys, or why this might be a benefit to you, is the simplicity of it. And so, not to be repetitive, but what we hear most often is, I just can't keep track of this. I don't know who to trust. I don't know what the different plans cover. And so the simplicity of working with Isac, knowing that this is a program that's sponsored by Isac, it's something we've been working in coordination with Wellmark on for quite a while now to make sure that what we were doing was in the best interest of Isac County retirees. So it's administered by a trusted partner of Wellmark for decades. And then to know that you have the assistance provided by group benefit partners. And so in terms of enrollment, in terms of considerations between what really is best for you, to be that one stop, that you would come to group benefit partners, we would work through you to make best choices. If you went with the ISAC group Medicare program, to know that you're working with Wellmark and that you have the sponsorship of ISAC behind it. In addition, and probably one of the greatest benefits is that the plan we are offering is Plan F. And Plan F is no longer available to purchase through Wellmark on the individual market. You would have had to be Medicare eligible prior to January 1st, 2020 in order to purchase Plan F. Now, there are some similar plans available through Wellmark on the individual market currently and ongoing, but Plan F, this is really the only place that you can purchase Plan F. So we'll talk more about what Plan F is and what that means, but that is a huge incentive that because this is a group program, we are able to still offer Plan F, which prior to 2020 is what we would always recommend to our individual Medicare clients. And so we're excited to be able to continue to offer that. And then finally, the pricing of the group program is different than the individuals. This plan is offered at a composite rate, which means it's the same rate across the board. So whether you're 65, 75, 85, or 95, whether you're male or female, you will pay the same premium for this plan. So logically, you can think about that there are some pros and cons that you will want to consider when it comes to what the cost is if you're 65 and getting ready to retire versus what the cost is if you're 75 and still working and moving into Medicare. And again, those are all things that we can help you navigate and help you make best decisions for you. So a little bit more about Plan F. It is the most comprehensive supplement plan that Wellmark offers. It's national coverage that is accepted anywhere Medicare is accepted. I did put on there the 2021 premium. And again, that's the premium for everyone. So some of that simplicity we see there also in terms of the cost. One other thing to think about, and this is information that I talked about with Corey. So Corey, if you want to jump in after I talk about this, and if there's anything you have to add, feel free. We can't predict the future, obviously, but we can explain what's happened in the past. And Wellmark has seen that group premium go up about 2, maybe 3%, kind of in line with the CPI index each year. So it's more easy to predict about what the increase in the premium will be on the group product. On an individual plan, you're still going to have that same 2-3% increase each year, but you're also going to have an age band increase each year. So the individual plans are priced based on age and based on gender. And so each year when you move into a new age bracket, so you move from 65 to 66, or you move from 79 to 80, you're going to see a jump in terms of what you're going to pay for a premium. So in that regard, while this plan at certain points in your life may be more expensive, the longevity of the cost and the consistency of the renewal is a little bit easier to plan. Corey, anything that I missed there, or anything that you would want to add from your experience in working with other groups on this?
Sure. Nothing necessarily, Katie, that you missed. I think you did a great job explaining this at a high level. I'll just add a few quick points. The first one is that, and I went through these slides with Katie, and I probably should have caught this on the previous slide. Nothing incorrect at all. I probably should have added a bullet, and that's that this is available to individuals regardless of where they reside. So one of the other differences in the individual market, if you're out shopping for a Medicare supplement plan on your own, you are required to live in either Iowa or South Dakota if you want to purchase a Wellmark plan. The great part about this group offering is that that requirement is out the window. So let's say you have an early retiree from an Isac group or an Isac employee who may move to Phoenix or Florida, wherever. Today it feels like it might be hotter than it is in Phoenix, but I can understand in February why someone would want to do that. But in the past, or on the individual market, if they moved to Phoenix at age 63, for example, they could not come back and purchase that individual Medicare supplement plan unless they had an Iowa address. So that's one really good benefit. I did want to add, Katie, I think you did a great job explaining Plan F. I would just add to the first bullet on this slide, just as a reminder, that this is the only plan we have in the Medicare supplement world that does not have a copay, it does not have coinsurance, it does not have a deductible requirement. Essentially, the way these plans work, the Plan F specifically, and the reason why they've been so popular is that if you go to the doctor or a hospital or whatever the setting might be, and if the service that you had as a client or as a patient is covered by Medicare, our plan picks up the entire remainder of what Medicare does not. So we hear over and over and over again from our folks who are on a Plan F, regardless if it's a hip replacement or it's an accident or a heart surgery or anything that runs the gamut, they're very satisfied with the F because they never get any bills. All they see is what we pay to the hospital or to the doctor or whatever it may be. And that's why that's been such a popular plan. And I think, Katie, you said it great. It's not available to most people on the individual market. They can't buy it on their own, but they can if they're an employee of Isac. And I think that's a fantastic benefit. And then the only other clarification on this slide is bullet point number 2. It's actually a little broader even than that. With a Plan F, it doesn't matter whether Medicare is accepted or not. You can go anywhere that accepts a Blue Cross and Blue Shield card. So even if they don't accept Medicare, there's a whole complicated set of rules that happens if someone goes to a provider that does not accept Medicare. I'll just say it very simply. It doesn't matter with the Plan F because Wellmark will cover all of those bills regardless. So I think you did a fantastic job of outlining. I just thought I'd add in a couple of those points.
Well, I appreciate it, Corey, and I'm sure glad that those points went in that direction and not the other direction. I think to supplement what we're saying and to show that it's even better is a great thing. And I took notes on those, and I will update this before we send it out so that when it's a document for reference that we have those pieces added on there. And so this is more detail, and I'm not going to read through it, but because I think Corey really gave an overview of it in terms of what this covers. So this gets into the specificities, but to reiterate what Corey said, this is the only plan where there's no copays, no coinsurance, no deductible. And so I think he explained that well. And this is just in a little bit more detail in terms of what that's going to cover for you. So some of the details about this group plan. And so if you're going, this is interesting to me, I'm curious. So this is effective July 1st, 2021. So I know we're really kind of up against the timeline there, but this is ongoing, remember. So this isn't like you need to sign up in July or you need to make your intentions known in July if you're retiring in the future or if you're turning 65 in the future. So the plan will start in July. Who is eligible? So you can see there, if you are a county retiree who retired as of 1/1/2020 or beyond, if you are an active member on the county retiree plan as of 1/1/2020 or beyond, as well as spouses. So those are our eligibility requirements. And then again, age 65, and you must be enrolled in Medicare Part A and Part B in order to enroll in the group Medicare program. That's really important. I want to point that out because if you sign up for this, but you have not signed up for Medicare Part A, Part B, it's not going to work in the same way that it's intended. So this is, again, a supplement after you have your Medicare eligibility or Medicare enrollment in those two pieces. So next steps, so, okay, this is great. I'm curious, I'm interested, or I may be interested next year. So what do I do? Again, this is all going to filter through our office here at Group Benefit Partners, our office in Clive. However, if you work with one of our other locations, we work together very collaboratively. And so certainly if you work with our Decorah office, or our Waverly office, and you are more comfortable reaching out to them, they can get in contact with us, and we can work simultaneously through our other locations. We have on their applications due by the 15th of the month prior to when eligibility begins, with the understanding that it is June 16th and this starts in July. So there is some flexibility there. We want, if this is something that applies to you right away in July, we will work with you. So I don't want to deter anyone from that. Very important, as I was reviewing the application yesterday, and we've said this several times, but you have to have parts A and B in order to enroll. And I put a little screenshot there that shows when you actually fill out the application for this Isac group Medicare policy, you will have to have your Medicare card with the Medicare number, because you're going to transcribe that directly onto the application. So again, reach out to us. We want to work with you. If you're wanting this to start the first of the month, you're having a delay with getting your Medicare card, the main goal here is for us to introduce ourselves to counties with whom we have not worked in the past, so that if you have any questions about Medicare at all, whether it's this group program, whether it's prescription drug plans, whether it's individual supplements, that you feel comfortable that you have a place now that you can use as a resource. Again, start thinking about those prescription drug plan options. Gather your pharmacy information, do some research on your own if you're so interested in doing that, or reach out to us and allow us to help you with some next steps. The very last thing I threw on here is a little bit of an outlier, but it's something that has come up over the past couple of months, that it's something that we want to kind of put out there just for the point of making sure you know your options. If you are pre-Medicare age retiree, so maybe you retired and you're 62, 63 years old, that's kind of the age that we're talking about. We have recently found out, and so you're maybe enrolled in the county retiree plan. So you're still, if your county allows that, perhaps you're still on the county medical plan, or perhaps you're COBRA-ing your county medical coverage, waiting to get to that Medicare eligibility. There are right now some very interesting options available through the individual marketplace, with some real cost savings. Some of the tax laws associated with that, we know, extend through 2022. And so we have to be careful with the number of people or the age range that we recommend this to. And so currently it's really people around 63 years old that we think that there could be a real benefit for you in terms of that couple-year transition, considering looking at the individual marketplace. Tyler in our office, who's part of this call, that's one of his specialties. Also, our offices across the state work extensively with individuals in acquiring individual plans. So it's just something we wanted to put out there. More communication for those of you for whom that may apply will be coming in the future, but we thought it might be worth mentioning here. So if you're in that range, you're 63, you're not quite Medicare eligible, but you're starting to think about options, there could be a bit of a hybrid that we could help you think about in terms of getting you through those next couple of years. So that ends kind of our formal presentation. This is our contact information. So if you have questions, you want to think through your individual scenario, you just want to know more, you know, you're a detail person, you want to know those dates, or you're just like, yes, sign me up, I'm ready to enroll, we ask that you please reach out to us. That's our phone number. They're here at our Clive office. I've also put a link to our website there where you can reach out via email to any of us individually. Again, if you work with one of our other locations and you're more comfortable reaching out to the representative there that you work with directly and saying, I want more information about this, they can also help point you in our direction as well. So again, the message that we want to convey here is we're excited that Isac is offering the group Medicare program. We think that there are some serious advantages to at least considering it as you think through your Medicare options. But even more so than that, we want to be a resource for our county retirees as they make that transition to say, we have extensive experience working with counties. We oftentimes know what your employer health plan would have been like, or we have the ability to help you make some comparisons to what your current coverage is and what you may be looking for as you enter into retirement and beyond. So I'll open it up now. Katie, I'm not sure if any questions came in, or we can pause for a minute here and see if there are any questions.
I don't see any at the moment.
Okay. And again, our plan to follow up here will be immediately, we'll send out the recording and I'll update the PDF a little bit to include the information Corey sent out. But as I was looking at the list of attendees, I know that it's a lot of either perhaps supervisors or auditors or other elected officials. And so what I want to do as well is to put together like a one-pager information sheet that we can send out that you may be able to include if your county is interested in moving forward with this, that you may want to include in your retiree packets or to post in a common area so that employees can know about this and can reach out. This is, again, it's available to all county retirees. And so certainly your individual county, you can make a determination on your own in terms of whether you want to spread and share this information. But the billing is individual to the employee. There is no county liability in terms of billing. Information goes directly to the individual, back to our office, and then over to Wellmark. So it's sponsored through Isac, but it is still an individual an individual plan in terms of the responsibility for billing.
And it looks like we did get one question in, and it just has to kind of do with timeline. So she had asked, she'll retire 12/31/2022, and she's currently 65. So what should she do then? And how should she reach out to us? So
Take it, Elizabeth, if you want to, if you think you have a good, go for it.
So if you're 65 years old right now, you may or may not have taken Part A, because I'm assuming you have your retiree coverage. And so, or sorry, your employer coverage. So let me know if that's not the case. But if you're enrolled with the county, there is a chance you waived A and B. About 3 months before you know you're retiring, you'd want to start that process with Medicare to get your Parts A and B effective for 1/1/2023 in your case. Okay, and she says she does have employer coverage. So you want to begin that process about 3 months prior. That time of year specifically is very busy. So getting your information into Medicare, allowing them time to get the Medicare numbers back to you. Then you would want to reach out to us, the number that's on the screen, or if you want to go through the county and go to your account manager that they have, we can help you from there to kind of figure out what option's best for you.
Lori asked, is this something we would want to list in an employee handbook? That would really be an employer level decision. And so, I think that my best advice at that point would be that would be something to discuss with the Board of Supervisors in terms of if this is something that your county wants to promote, not necessarily financially, but wants to make sure that employees are aware of. to me, just personally, kind of off record, even though this is being recorded, I think that's a great idea in terms of how to let employees know that this is an option. But anything like that, we always defer to what your Board of Supervisors recommends in terms of how you want to communicate information to employees.
And then
A question about fee to the county to offer this. No. So this is, while this is sponsored by Isac, this is not affiliated with any particular county. Now, if your county were to say, wow, we love this, this is something we want to really get behind, we want to work more closely and promote, you as a county can reach out to us and we can work with you in terms of how to better market this to your county employees. But currently this is an Isac wide, so all 99 counties are kind of coming together in terms of setting this up under Wellmark. So no fee, no county risk or liability in terms of offering this, no.
It looks like we had one more.
And this might be a Wellmark one. I'm not sure, Elizabeth, maybe you can answer it, but.
I'll let Wellmark, I'm not retired yet, but my spouse is. He's past 65 years, but is not on Medicare yet. He's on my family insurance. Would he be eligible to get on the Plan F after getting Medicare A and B, even though they're not retired? And so I'll let Corey. Yeah.
Sure. So the answer to that question, generally, I'm just reading through it to make sure I have this right. The answer to that is when you retire, whoever typed this in, so your spouse is not on A and B yet, but when you retire, he would need to then enroll in A and B if he hasn't done so already. He can do that at any time, but when he enrolls in A and B, then he's eligible for the F, and he would be eligible when you retire then. And the reason why is there's some federal guidelines that prevent groups from encouraging or enticing individuals who are over the age of 65 and eligible for benefits. And he would be eligible for benefits through you until you're done working. At the time when you're both retired, absolutely, he would be eligible because as I read the criteria, you are on the group plan after 1/1/2020, and your spouse would then be eligible. But federal guidelines would prevent him from enrolling in this group sponsored plan until you're both retired, if that makes sense.
And I just want to clarify, and maybe I'm thinking about this wrong, because Corey, you were speaking about Isac Group Plan F, correct?
Yep, that's correct.
And I just want to make sure that this individual was not referencing the old individual Plan F if her spouse would have been Medicare eligible prior to 1/1/2020.
Correct. So good point. So as always with Medicare, we get complex somewhat quickly, but yes, on the group plan, you would have to wait for both of you to retire. If you want to go out and purchase your own individual, enroll in Medicare A and B and purchase your own individual Medicare supplement plan, he, she, whomever can do that at any time. The requirements are correct that were listed earlier or discussed earlier in the presentation. If you want to buy your own Plan F from Wellmark or any other carrier for that matter, you would have had to become eligible for Medicare prior to January 1st of 2020. So if you want to buy it on your own, you would have had to become eligible for Medicare prior to that date. If you want to participate in the Isac plan, it doesn't matter when you turn 65 to get the F. However, federal rules do say we'd have to wait for you both to be retired, if that helps. So I know that could get complex and a little confusing, but hopefully that helped.
That helped me a lot, so I appreciate that. And again, these questions, we're used to these and we anticipate these, and so we certainly know that more will come up, and that's our intention here today, is to introduce ourselves. To those of you who know us, we haven't spoke much about Medicare in the past, and so to share with you that is also part of what we do. And then also to those of you who haven't worked with group benefit partners in the past, to introduce ourselves for the first time, or to refresh you with who we are. And really this has nothing to do with whether you are part of the other group benefit programs through Isac. This is completely separate. And so we are happy to be able to assist retirees from all 99 counties with this.
We did have 2 more come in if we have time.
Yeah, I do.
Okay. Am I and my spouse going to be eligible for this even though we have been covered by his employer insurance, which is not county employer sponsored? So it's not through her insurance and she works for the county. Let's see. Corey?
That is a great question, and that is, I don't know that I actually have a great answer to that right away. This is something that would be deferred to Isac, as Isac is who sets the eligibility requirements. And so I don't know if I'm not going to put anyone from Isac on the spot and say, speak up to this now. But I appreciate that question coming up because it's something that we certainly will follow up with. And Kathy, we'll get your information, but then that's also something that we can clarify when we send out the recorded version of this and the PDF. I don't want to make an off the cuff remark that ends up needing to be retracted. So I'm going to ask you to be patient and let us get a final answer on that.
And then one other, so I am retiring in January and turning 65. My husband is currently on Medicare A and B. What would the cost of the supplement plan be for both of us when I retire?
I can take that one if you'd like,
Great.
or you guys
Yep.
jump in. So that varies. There are a number of costs, of course, with everything. So just to give you a ballpark, and I don't want to lock down into particular figures, but let's start with if you chose to go through the Isac group Medicare supplement plan. I think that amount was listed on the slide a couple slides back. We don't need to scroll back, but it's around $208, give or take. I think it's $207.80 or something like that.
Yep.
But if you ballpark $208, if you and your husband wanted to participate in the Isac plan that we talked about, that plan F, it would be about $208 each, obviously, per month for that supplemental coverage. Now, if you chose to go kind of what we talked about in the presentation and what Katie talked about in the presentation, if you chose to purchase your own Medicare supplement plan, those rates can vary depending on which plan you pick, depending on your age, depending on your gender. Sometimes it even depends on your tobacco status, whether you smoke or not smoke. Those can all impact the rates. So those could vary anywhere from, $110 or $120 a month all the way up to $180, $190, depending, and even higher, just kind of depending on all those factors. So it's very hard to give you a number in the individual market. It just depends on a lot of different things. So what we shared earlier is the plan F for Isac, and that's a pretty solid rate, in my opinion, for an F. And as time goes on, as we mentioned, those rates have tended to be pretty solid. So that's what we know. Prescription drug plans, as we've talked about, that's another thing that you are required to purchase by the federal government, or generally required anyway, I should say. Those plans can also vary in premium. You might see some plans out there, maybe in that $20, $25 range per month, maybe even cheaper. And then they can go all the way up to $120, and even higher sometimes if you're taking very expensive prescription medications or you need some special medications covered. So I know that's a big range. It's kind of difficult to give you that without going through the process that Katie outlined. So that's a ballpark. I know that's kind of broad, but I would say, the F that we've covered, we know that one for sure. It's about $208 a month.
And I can just jump in quickly too. And in the interest of full transparency, our intention here is to educate, and then we can sell products to you if you want, but our main intention is to educate. And really, most likely there's going to be a period of time where the group Medicare program is probably more expensive than what you could get on the individual market if you're 65, because the Isac program is composite rates. And some of the research I did in terms, and again, I can't speak precisely because it varies quite a bit based on what you're buying, male, female, tobacco, non-tobacco, but it's somewhere around age 70 where then it turns a little bit and the Isac group Medicare program becomes more affordable. And so, and then if you think about the average lifespan of an individual, so, you know, there may be a period of time there where it's not the most cost-effective plan that you can buy. We feel confident that it's going to be the most comprehensive plan. We feel confident that it's going to ease in the simplicity of enrollment, of questions and things like that. And then long term, we feel very confident about the cost of it and about the longevity of the consistency of the cost. But again, we absolutely would give you the best advice in terms of here are your options, here's what is available, here's the pricing for everything, and then work with you on making those decisions. Well, we kept it under an
good.
hour, which
There's-
oh,
you
we
hear
got
me?
another one. Good. Okay.
Yep,
One
go
more.
ahead. So it's in the chat window. Says my husband is disabled and age 63, has Medicare and also MEPD coverage through an MCO. Plan to retire early at age 60. Will he be eligible for Part F then, or not until I apply and the Medicare eligible?
You know, Lori, my first instinct would be that, you know, our preference would certainly be to work with you individually, to make sure that we can take all factors into consideration, particularly when we have this new consideration of some individual plans on the marketplace to get through that transition period. So, and because there are some extenuating circumstances here with disabilities and things that kind of go beyond the typical Medicare experience. So if you're okay with it, I would say that we would really want to work with you through this. That this would be one of those scenarios where that we want to make sure that we collect all of the different pieces and make sure that we're doing our research and due diligence to make sure that we're taking everything into consideration and giving you all of your options. And Lori, are we able, Isac, to get Lori's contact information?
I have it, yes.
Perfect. Thank you. Well, if there are any more questions, I can fill up about 30 seconds of jabbering to make sure that we're capturing everything. But I'm really grateful to Isac for the opportunity to present to everyone today, for the work that they have done on their end, the questions that they have asked of us and of Wellmark to really ensure that what we're offering is in the best interest of county retirees. And then grateful also to our Wellmark teammates for making time to be here today. I know that this is what they do and what they specialize in. So I appreciate them being here to help give us some guidance. And really appreciate the attendance of everyone who took time out of their busy day to learn about this. No question is too big or too small, you know, whether it's a question about you as an individual, whether it's a question about how to best inform your county employees about this. Again, our phone number is listed there. If you work with me or if you work with Elizabeth, you have our contact information. If you don't currently work with us, our information is available on the GBP website. You can also get it through Brad, but we are pretty easy to reach. If you call that phone number, one of us will answer it, and we will know what you're referring to, and we will be able to get working with you right away.
I don't see any more comments or questions coming through. So thank you so much for your time today. It was a really great presentation.
Thank you. Thanks to everyone. We enjoyed it as well.